Hi, my name is Catherine Wall. I'm with the Springfield-Greene County Health Department. I'm excited to be here today with our Director of Health, Clay Goddard, and our Chief Medical Officer, Dr. Nancy Yoon. Thank you both for joining us today. We're excited to be talking about vaccine. Clay, it seems like just yesterday, and in other ways 30 years ago, that we were talking about the basics of coronavirus and what we knew and what we didn't know. So just to start off, what does it feel like for you to be at this point?
Wow, it's for me a sense of relief, a sense of resolve, knowing how far we've come, the pain we've suffered as a community, but also knowing that we're at the end game here. We have a pharmacological intervention that we can utilize, and so that's a huge relief. But we also need to understand as a community that this is going to be a heavy lift and probably the most monumental lift that public health has had to do in its history in this country. So it's with great excitement, but also resolve, knowing that we're going to have to finish this strong. And so I'm excited to do that with you as a community.
Yeah, I agree with you. I think there's a lot of excitement. I think our community wants to know a lot more, and that's a reflection of the excitement that is and the readiness of people to be in this next phase. So there is a lot of interest in the COVID-19 vaccine, Nancy, but let's start with just what are vaccines in general and how do they work?
The body's immune system is designed to recognize germs that can enter the body and cause illness or infection. And viral vaccines specifically teach the body how to recognize viruses and fight it off by forming antibodies against it. And if a person is exposed to the SARS-CoV-2 virus in the future, it will remember this and form antibodies which can actually attack and destroy the virus and keep the person healthy and without having the infection.
So the first of the COVID-19 vaccines are mRNA vaccines. You know, it's not been all that long that we've had them, and already you see misinformation out there about things like DNA and how it might affect those different things. So can you explain a little bit about what the vaccine does, but also what the vaccine doesn't do?
Sure. So the Pfizer and the Moderna vaccines are both mRNA vaccines. And when mRNA enters the body receives the instructions on how to make what is called the spike protein. And the spike protein is located on the outer surface of the SARS-CoV-2 viral particle. When the body detects this, it forms antibodies against the protein. And so again, if you're exposed in the future, the body has a memory and can form the antibodies which will attack the virus. mRNA does not enter the cell nucleus, so it doesn't alter or affect our DNA. And even though it is a new type of vaccine technology, it's actually been studied for over a decade.
Clay, you've been in public health for more than 20 years, and vaccine hesitancy isn't something that's all that new. Vaccine misinformation, unfortunately, isn't new. So what would you tell people about vaccine hesitancy and what they need to know?
Yeah, it's not new, but it does seem like it's more prevalent today than it once was. I think it's important that we really get some perspective on this. If you look at the last 200 years, the average American's lifespan has more than doubled. And most of that is due to public health and medical science. So let's think about that. It's through sanitation, it's through nutrition, it's through better understanding of disease process and medical intervention, but a big chunk of that is also through vaccine science. And it's easy for this generation to forget about the ravages of communicable disease and what they once were in this community. You go back as recently as my parents' generation, and it would not be unusual for a child to disappear because they've become infected with a communicable disease. And that disease would either take their life or disable them so they could not return to school. That is totally avoidable because of vaccine science and the robust book of vaccines that we have available to combat these illnesses. Vaccines are safe, they're effective, and ironically, the one group that I'm not worried about accepting this COVID-19 vaccine are our elderly, because they've had personal experiences with communicable diseases and they understand the burden that they can put on society. So I know that vaccine hesitancy is going to be a concern, particularly with marginalized populations who maybe don't trust institutions. We're going to be working hard to try to build a bridge and to educate people. But I view this vaccine as safe and effective and really something that you should strongly consider. Do your research, talk to people that you trust, and let's find a way to bridge that gap and get as much vaccine into arms as we can.
Clay, one of the things that strikes me about this particular response and all the science that's gone into it is that it's also been a very transparent process. There are lots of places to look that will have validated information. There's data out there that the FDA is using to evaluate. So where would you point people who are saying, I just need to learn more?
Well, number one, you need to go to reputable sources. So, I would encourage you to go to our health department's website, to go to the Missouri Department of Health and Senior Services website, the CDC, the FDA. Facebook and Twitter may not be your most reliable source of information. And go to a trusted source, go straight to that data, look at what the scientists have reviewed, and that's a good starting point for anyone who wants to validate the safety and efficacy of this vaccine.
I'm so glad you said safety and efficacy, because we know that those two are central tenets to vaccine development. So Dr. Yoon, can you talk a little bit about how we ensure the safety of vaccines and what we mean when we say efficacy?
Sure, and echoing what Clay has said, the development of these vaccines really has been a remarkable feat and achievement of the scientists who have done rigorous studies tirelessly to provide this technology and this innovation that we can all benefit from. So we are truly grateful for their efforts. And again, safety, and that was really one of the paramount things that they were considering. The Pfizer study, there were over 40,000 participants. In Moderna, there were over 30,000. So very large numbers that were looked at. They looked at a variety of ages, ethnic and racial groups, and people with underlying medical conditions to see the effects, if there were any differences in these groups on the vaccine. And really, there have been very few reports of serious adverse effects. So we do feel confident that these are safe vaccines. In addition, the ACIP, they're an independent review group that looked at the clinical trial data and the efficacy and the safety, and they thought that it was safe, and at this time that the benefits outweighed the risks. Also, even though these vaccines are now or soon will be available, there will be ongoing safety analysis and mechanisms for reporting adverse events. So we'll continue to study these and learn as much as we can, but we do feel that they're very safe at this time. And when we talk about efficacy, this means how well the vaccine actually protects a person from getting a symptomatic COVID-19 infection.
And to add on to that efficacy piece, it's remarkable to have a vaccine that exceeds 94% efficacy. And that was also helped along, and it helped speed the study up because of the severity of this pandemic. So we had a lot of disease in our communities in which they could very quickly run through the clinical trials and test the efficacy of this vaccine. So that's a little bit of a double-edged sword, but it did help speed the process along a little bit. So we're very grateful, and I was quite frankly surprised to see efficacy of that level.
Yeah, I remember in the office when we heard those numbers, we all kind of paused and went, this is fantastic, this is an exciting thing. Another hot topic that we've heard a lot about, and sometimes in correct context and sometimes in incorrect context, is herd immunity and just what that means. Nancy, can you talk a little bit about what herd immunity is in a public health context and also what it isn't?
Sure. So herd immunity is when a high enough percentage of the population needs to be protected against a particular disease. And at this level, a virus or a bacteria, if it's circulating, if there's high enough immunity in everybody, then it's unlikely to be able to spread quickly. which it is now, COVID-19 without the vaccine. And so this is a mechanism that we can protect people who are susceptible or who can't get the vaccine, because if enough people are immune to it, then the virus won't be able to circulate as it is. And it can vary the percentage that is needed to have herd immunity for different diseases. But for COVID-19, it's estimated that about 70%, at least minimum, of the population needs to be protected to achieve that herd immunity.
You know, Clay, a lot of what I've heard among the general public, among people who are calling me and asking me as a health department employee, what do I think? There's a lot of concern about speed. This came across really fast. Can you talk about a little bit more about the science that went behind this and why that timeline could be sped up?
Sure, and once again, we're fortunate in that they were already working on vaccines using this messenger RNA technology specific to both SARS and MERS, which are outbreaks in the not too distant past. I think SARS was 14 years ago, and MERS was more recent than that. And fortunately, both of those outbreaks were able to be suppressed, and that disease is not circulating. So that really stopped those vaccines from further development. I think they stopped in phase 1. And then they were working on vaccine for Nipah virus, and they were simply able to take that genome and replace that spike protein into what they were using for Nipah virus. And in the case of the Moderna vaccine, they were able to stand that up very quickly. Same with Pfizer, they were able to pivot very quickly based on their experience using this for other conditions. And that allowed us then also to have all of these scientific assets pointed to one condition. And I mean, we're really seeing the benefit of technology and the role technology can play in very quickly combating a communicable disease. It's a very exciting time. This is really, to me, equivalent to the moon launch for our generation. Such a huge leap forward in scientific information and in medical intervention. It's an exciting time to be alive, and we're really, literally living through history right now that our grandchildren will learn about.
I really like that analogy of the moon landing, because in the conversations you and I have had, have you ever seen anything focused so intently when it comes to public health? All of the financial resources, all of the scientists, all of the physicians who've come together to make this possible, it's remarkable.
It is remarkable, and the collaborative spirit among scientists and then the federal assets that have been poured into this have really made this possible. So we've been very, very fortunate, because without this there would be many, many more lives lost, and we're hopeful that we can minimize that by getting this into arms as quickly as we possibly can.
So Clay, it probably will come as no surprise to anyone watching this video that you are excited to get the vaccine, and you also have people in your life that you want to get the vaccine. So what would you tell those folks who are hesitant, or the people who want to help us get the word out?
Well, I am excited, and I'm going to wait my turn, obviously, because there are people that have higher priority in our community, the healthcare workers that are frontward facing, working with patients directly, but additionally those that are aged or have chronic health conditions. I've got several people in my life that are going to be candidates for fairly early vaccination. My wife's asthmatic, and so I've encouraged her to get the vaccine. She's a nurse, so she was an easy sell. My mother also is eligible for the vaccine, and I've highly encouraged her, and she's going to take the vaccine as well. So I think that's an excellent point. As you research this vaccine, and if you have a comfort level with it, I would encourage you to reach out to those that you love, that you're worried about, that might be at higher risk for disease complications. Be an ambassador for the vaccine. Help us build trust in the community, because that's going to be oh so critical as we're looking at reopening this economy and getting past this nightmare that this pandemic has created for us.
Well, thank you both for joining us today and for talking about something that obviously you both are excited about. I think our department's really excited about, and the public health community is really excited to be at this stage in our response. The Springfield-Greene County Health Department is dedicated to keeping our community up to date with the latest news and information on the COVID-19 vaccine. You can find that at health.springfieldmo.gov/COVIDvaccine. You can also reach out to us Monday through Friday, 8 to 5, by calling our call center at 417-874-1211, and you can also email us at coronavirus@springfieldmo.gov. You can also see us on social media at SGCHD.